We have a slogan, helping today, building tomorrow. Families, in most cases, are going to come to us because they need help now.
I kind of felt like we were thrust into this and not having a clue of what we were doing. I didn't know where to go.
We didn't know what to do. I mean, I can read a book, about autism, but that won't teach me how to handle my daughter because she is different.
Autism is all-consuming to us on a daily basis. I can't even imagine taking this walk without AZA.
Arizona Autism United is all about the families.
Our vision from the beginning was to be an organization that provides these services that families need, but to involve the families in the building and improving of the organization over time.
It's a grassroots organization, and it's got deep ties to all different parts of the community. And the people that work here, sometimes their own children are receiving services here. So this is not just a place they work, this is the second family.
At AZA United, we know that we have the people, the professionals, to really make a difference in families' lives.
There's a lot of families out there that need a lot of help, and we are uniquely equipped to bring evidence-based practice in terms of behavior analysis, but also make it work.
The difference between AZA and some of the other organizations was AZA just had a bigger heart.
It's genuinely driven that they care from the heart. We want to be in your home. We want to help your kids. And it's really cool because those are the people you want working with your child.
When a typical learner starts school, they have all these skills under their belt, right? They can play with friends, they can ask dad for a snack, they can tell mom they have a tummy ache. Learner with autism doesn't necessarily do that. And so it's up to us in the home-based services to make sure that our children can do those things too. And we can, which is what's so great about ABA.
What's that?
One.
Good job. What's that?
Mom.
When Ella first started, she didn't have very many skills to start with.
Back in the day, earlier day, you can call Ellie and say stuff. You can clap your hands, make noises, whistle, whatever, and she just walked on past you like you weren't even there.
We started with very basic things like eye contact, matching pictures, playing with others, just engaging, and she took off so well.
It's a cat.
Apples. Cups.
Cups.
Way to go!
Once AZA, we got involved in, we had the ability to come to the house, instantly we started seeing different things happening.
We use ABA therapy because it's been proven to be effective over the years, has tons of research and backing, and all the strategies and techniques, they work very well with our client base. We want to promote as much independence as possible, and if they know how to get that on their own, then they're going to continue to grow with or without us there.
Ready, set, go! If you're doing ABA well, it looks like you're playing with the kid.
Uh-oh, where'd you go?
And then we're taking data to see if what we're doing is effective.
Once a month we have a meeting. Everybody gets together and goes through everything step by step by step. And the data that's tracked, it's so helpful. She just got a graph done, and it was just a huge incline. And I see it every day, but to see that incline was just like validation that it's working, it's working, it's working. And she responds to them so well, and she loves them. And those are her friends. Those are her friends that come to play with her. People that haven't seen her in a long time are just absolutely blown away. They're like, oh my gosh, she looked at me, she walked up to me, she was playing with me, she was laughing, like she was engaging with me.
That is an aha moment to say she is aware, she wants to see us, she is acknowledging her name, and she knows who she is, and she knows who her family is, and it matters.
Earlier on, Elle was in her own little world. Now that she's in our world more than hers, I'm most excited that she gives us kisses now too. I say, hey, give Daddy a kiss. She come over and give me a kiss. And I never thought that was gonna happen, to be honest with you. I like having the daddy's little girl thing. She's just my little princess.
The behavioral health program, at its core, it's a parent training program. We help the parents learn the technical skills to intervene on those problematic behaviors in a new way that makes them less likely in the future. And oftentimes, be more the parent that they want to be.
We came in and we asked what the problems were. Then we asked, what problems do you want to work on? And those are the ones we're going to tackle. Dolly has a hard time communicating. She's using her device to request things. She's pointing at us.
Like if she wants to sleep, she can point out, saying that I want to go to bed and I want to use the bathroom. I think what are you doing? It was not about Dolly. Dolly is the kid. She will learn what we're trying to teach her. So it was us. I think it was a big learning for us to be consistent.
This is, I think, our third month or so with the AZA, and the main reason we kind of wanted this program was I was not comfortable taking her in community. I was having problem because of her noises, throwing herself on the floor, or main thing was grabbing food. I was kind of like a prisoner in my house.
We get a lot of parents that tell us that. They describe it like they feel they're chained to their child, and that's not the kind of bond that we want for them. So that's what we work on, getting the kids to be able to go back into the community, go to family functions.
Let's go. So today we're going to Sprouts, and our goal is to get Dolly to go through the store without taking food off the shelves or out of the bulk items. We will be using praise to get her to successfully get to checkout, pay for the items, and then get an edible reinforcer at the end of the day.
We have used several other agencies since last 4 or 5 years for the same type of stuff. The main difficulty we had was they would come and they will just observe what we are doing from from the corner. If they had to give us feedback, that feedback would not be at that particular moment when behaviors is happening. They would send us a report in written. With AZA, it was completely opposite. We get a lot of practice, go to community almost every visit. It's not like telling us a list of things that we need to do. We are actually doing it, and then we are problem solving it. It's a real-time feedback, instant.
Today, Dolly did great. She was able to get through the store without any attempts to steal food. She had a couple moments where she was kind of getting upset, so parents started walking. Dolly walked right behind them. So I would say even mom had big strides today. So it was an extremely successful day. She was happy, she was smiling. I couldn't have gone any better than that.
Traveling as a family always has been another challenge.
We went for 8-day travel. I feel like Dolly did wonderful throughout the whole trip.
And it's not that she didn't have behavior, she did. She was crying and doing all that, but I was able to say, hey, this is what it is, we are doing it. So that was a change, which I was lacking before, and I think that really has helped. I see that there is a progress coming. That's improving quality of life. I mean, I'm more confident and I can enjoy more time with her and she can enjoy more time with me.
It is very hard when parents can't connect with their child initially, when the child isn't communicating and they're often not sure how to interact with their own child. There's such a wide range of goals that we work on in speech therapy, anything from teaching basic words and functional communication to more advanced social conversation. We very much encourage parent involvement. We talk through our strategies and encourage that they use these same strategies all day long across any environment that they will be in.
We're getting ready to go swimming.
When Jacob was 3, he had about 5 words that we could understand. We've seen so much growth. It's pretty incredible.
He eats balls.
He loves to come here. He loves his sessions with Nicolette.
He grows each and every time, and there are moments where Cindy and I know he's on a burst where we know that he's just absorbing everything and really applying it appropriately.
I feel excited. Yeah, when we're waiting.
There's more than autism. See my little boy for the little boy that he is.
To the floor. Yeah, and look.
He's got a lot to say, and if we know how to work with him, he's able to say it. And if we give him the tools he needs, he'll be able to say it to anyone.
I like to work on emotions. I like to work on expected and unexpected behaviors. I like to play computer and say hi to everyone. Hi, Jen.
Hi, Jacob. How are you today?
Good.
Good. Are you having a good day?
When I started working with him, he was a nonverbal 3-year-old. So now that he's talking in full sentences, using social conversation, it's really amazing to see how far he's come. And I'm so proud to have been part of that progress.
Okay, see you tomorrow.
I think what has made us successful from day one has been we care about the kids and we care about the families, and we're committed to being the absolute best we can be and to getting better all the time.
We want to help every family to get to where they need to be, wherever they are in their journey.
I have all kinds of hope now, and I have a lot of belief that she's going to actually become a person who lives in our world all the time. And I can't wait for that to happen. I know that's going to happen.
We really want to provide as many services as we can to as many families as we can serve, but we need the help of the community.
The challenge is that there's so many young families that have newly diagnosed children, they don't know what to do. And there's such a great need that there's waiting lists.
We have parents who their child just got diagnosed. They can't wait 6 months to go through the paperwork to get help. They need something today. That's where we seek donations to fill in the gaps, to help people who slip through the cracks.
The need that exists to continue supporting an organization like this, it is important for us to be aware of that, and if we have a little to give, to be able to share that.
What giving that we and others can do, it directly helps families in Arizona.
Yes.
And I think that's most important to me.
If you haven't had that experience, if you haven't had an experience where you walk away saying, this person's life is improved because of what I have done, then you need to have that. That's an experience everybody needs to have.